Why do 93% of the world's leading multinational companies prefer certified professionals? Because they tend to be committed to higher standards and ethics and maintain an informed intercultural competency. Whether you're seeking to build a career or to upgrade your HR professional career, you need to get trained and certified at the HR Certification Center today. Our experience in training and certifying HR professionals is unparalleled. We're trusted to offer a comprehensive portfolio of advanced professional credentials for the HR professionals worldwide, and today, more than 500,000 HR professionals worldwide in 125 plus countries proudly maintain our credentials as a mark of higher professional distinction. HR Certification Center. Call or WhatsApp today on 0244 122 855.
HR Certification Center commits to a higher standard. HR Certification Center commits to a higher standard. Certification Center commits to a higher standard.
All right, good evening and welcome to today's webinar. I believe most of us are probably done with work and heading home, and would like to welcome you all to this platform. Okay, hi Nanekia. You can just use the chat button and let us know where you are reaching us from. And if you can hear us loud and clear, you can do that too. You can just mention hi. My day was good. Heading home, still in the office. I'm going to grab the kids from school. You can let us know whilst we wait for other participants to join, and we would start shortly. Okay, it's Pink October, and we are all in the mood to pink it out. We are trying to create a lot of awareness on breast cancer. My name is Ann-Bertha Adjartey, and I'm the Admin and Training Manager with HR Certification Center, and I will be the host for today. We are organizing this breast cancer awareness webinar in collaboration with Ghana Canada Medical Center, and we have their resident doctor with us, and he would be taking us through this session. We are all aware that as HR professionals, we are better placed to drive this education on breast cancer. Hi, Mary. Okay, you're still in the office. All right, so I guess you'd have a good internet to listen all through. We'll be running from 5 till 6, so we could round up. We've also realized that quite a number of our workforce is made up of women. And as HRs, we have to try and put in the human aspect as well when we are working with our team members. I am sure most of us are trying to create some awareness in our various organizations, and we are driving this awareness as well with the HR Certification Center. We have our doctor on with us, and he would be taking us through this session. Dr. Joe, you're welcome.
Thank you very much.
Okay, thank you for accepting to speak to our participants this evening.
Oh, it's Anana. It's Anana.
Okay, I know today has been busy for you already, and I see you in pink.
Yeah, this is the closest to pink that I could get.
We're happy to see that you're joining the force. All right. So, what do we need to know about breast cancer? There are so many myths out there. And before we start, someone told me that aside the big, small, there are some medium sizes too that we have to pay attention to. Some people feel that if your melons are too big, you are most likely to be prone to breast cancer. I'm sure there are a lot of myths out there that you would want to debunk this evening.
Yeah, so it's all in the presentation, but
it's all in the presentation. Great. All right. So I'll allow you to flow now. We'll take questions when you're done with your presentation, and then if we have any other contributions, we'll add up to it.
All right. All right.
Okay.
Okay, so good evening once again. My name is Dr. Oduro. I'm the resident medical doctor at Ghana Canada Hospital. I'm here today to talk to you about breast cancer awareness. Generally, just to increase the awareness, prevention, any questions that you have on breast cancer, I'm here to help in any way that I can. All right, so we are going to start. So first of all, what is breast cancer? Breast cancer in general is actually a disease which happens when the cells in any particular part of the body kind of like goes out of control. When I say goes out of control, the cells have a specific program that they follow. think of it like a software that you follow as to how they replicate, that is divide. So if for any reason, most of the time mutation happens and then some cells are not following that particular program and they go unchecked, that is, there's no other system to clear it out of the system, then we are in trouble. It means it can spread, and that is when it becomes fatal. So usually our body has a system in check to make sure that, because all the time our cells are replicating, and definitely, even though the human body is a very good machine, because if you think about the number of divisions that happen, and yet cancer is, in quotes, a bit rare, you thank our system very much. But then there's a process in place so that in case there's any mistake and there's a mutation, it is quickly deleted so that it doesn't affect the next kind of generation. So if that system too is not able to detect the mistake and there's replication of the cells that don't follow the program, that is when cancer as we know it occurs. So this is not specific to breast cancer, cancer anywhere, cancer of anywhere of the body you can think of. Just that it's usually more common in cells that tend to replicate a lot. When I say replicate, I mean divide. And as we know, the lining of the cells, the lining of the breast, where the milk is produced, there's high amount of replication over there. So that's why there's an increased risk. All right. So with our statistics, unfortunately in Ghana, it's a bit difficult to get the right stats. This is what I found, but I'm very positive that it should be more than this. So annually, we are diagnosing, these are new cases, about 4,400 new cases. And unfortunately, half of them end up dying. Unfortunately, half of them end up dying. But worldwide, according to WHO, as of 2022, we are diagnosing 2.3 million women annually, and about 670,000 of them are dying. So that's around 30% mortality rate, that is worldwide. And in Ghana, we are doing 50%. So it means we are not doing a good job at all. It's bad. It's really, really bad. Because if we are higher than the rate worldwide, then that's very bad. So we all have a role to play in making sure that we reduce this number. And a program such as this, I think, is part of the war against breast cancer, that we are all soldiers. And I know we all know this, but I'll hammer on it, that if you put aside the skin cancers, usually we don't add them when we are talking about the cancers, but the most common cancer worldwide is actually breast cancer. That's the most common cancer worldwide. But when it comes to mortality, as in the killing, it's number 2 behind lung cancer. And one of the reasons is because of the awareness, of course, because we've raised awareness, and then people, as soon as they get a lump, they go and check and stuff. That is part of the reason why, at least, it is not the number 1. It's not the most common, and then the most common killer. At least it's the most common, but when it comes to killing, it's second on the list. And we are trying as much as possible to make it very, very low, as much as we can. So a quick anatomy of the breast. I know we all know, I'm sure everybody on this platform has seen a breast, an adult's breast before, and knows how it looks like. But we'll go through a simple anatomy. So this is the 𝗕𝗿𝗄𝗧 complex. And then this is a kind of like transverse view of it. So it's like you are looking at somebody who is not facing you. The person is like facing a wall, and you are facing the person. Let's say you divide a human being into 2. That's how this image is showing. So this is the nipple, if it's showing that way, and then the areola, and then these are the ducts and they go into the big ones are the lobes, and then there are small things in the lobes called lobules. That is where milk is actually produced, which will pass through the duct and then come out through the nipple for the baby or whoever is there to be able to suck. So this is a very important diagram because the types of breast cancer actually depends on this. So as you can see, the lobe and then the ducts, these are places where replication occurs a lot. When I say replication, cell division occurs a lot. So there's a very good chance that a mistake may occur, which the body may not necessarily see, and then a cancer will happen because of that. Okay, so this is just another view. This time, you can see that this particular tissue has gone out of control. So you can see that the color is a bit different from the normal ones here. So it has now become cancerous and it's doing its own thing. I like it very much because there's also another small one here, which is a lump, a benign lump. So this time there's a growth, but it hasn't gone out of control like this one. It's still following the breast's program, that is the body's program. So even though it's not normal, at least it's still following the breast program. So it won't spread to other parts of the body because that's not what the breast does. So that's a benign lump, and then there are a lot of examples like fibroadenoma. Usually these things happen in younger women. Okay, so what are the types of breast cancer? There are so many ways to differentiate breast cancer, so many ways, and they are all such that it will help us clinicians and then the patients also, as in when it comes to treatment and stuff. So I don't think for this particular presentation, it's very, very important for us to go in depth, but at least, like I said, we have ductal carcinoma. Carcinoma simply means cancer. And then we have lobular. So the ductal is in the duct, where I showed you from the nipple coming from what connects the lobe to the areola. That's the duct. And then the lobular is when the cancer is coming straight from the lobe or then the lobular unit itself. And then another way of classifying it is you have in situ and then invasive breast cancer. For this, I would have to show you something. So when we say in situ, it's basically like the cancer has formed, but it's very, very, very localized. It hasn't broken out of its shell yet. So the cancer is there, but it hasn't broken out of its shell yet. So in that case, usually it can be resected by surgery. And then invasive is when it has actually broken out of its shell and we are in danger. So the risk factors for breast cancer. We'll start with age. So as the age increases, the chances of a woman, I mean, first you have to be a woman, even though men can get it, it's a bit rare. So let me say a woman. As your age increases, your risk of getting breast cancer also increases. And a simple way to think about this is, like I said initially, it's all about division and the body following a certain program. So if you've lived long, it means that your cell has been replicating for very long. So statistically, there's a very good chance that a mistake may happen, which may not be detected. Plus, I mean, as we age, sometimes our immune system and other things tend to go down a bit, which increases the chances of these things going undetected. So I think the age is 50, but mainly over 60. But so if any woman comes to me at the clinic and is over 50 and has a lump or has pain or a discharge or anything, I'll be more alert compared to, let's say, a 20-year-old who has come with the same features, because the 20-year-old is more likely to be benign, even though they can also get cancer, but it's rare. Okay. And then gender, of course, women. So about 1% of breast cancer occurs in men, but most of the time it's in women. And then genetics. So if you have a family history of breast cancer, and when I say family history, I mean first degree relative. So first degree relative is usually as in your sister, or let's say your mother, someone who is in your nuclear family, not maybe your cousins, sister, not that kind of thing. So if you have a first degree relative who has breast cancer, and even that one, it's when in Ghana, the genetic testing is not very common, but even that one, it has to do with these genes, mutation in these genes. We call it, we usually say BRCA1 and BRCA2, BRCA1, BRCA2. So if you have mutations in these genes, then that one, your risk of getting breast cancer is increased. The same with, this is a tangent, just by the way, with prostate cancer, the same genes are related to prostate cancer. If you're a man, that is. And then other risk factors, lifestyle, so smoking and then alcohol consumption. As for smoking, especially tobacco or cigarette, tobacco is a known carcinogen. So tobacco is a very, very well-known carcinogen. So anytime you're exposing yourself to it, you are destroying the mechanisms or the programs in place where the body has made to detect the wrongdoings in the cell replication and then kind of like cancel them out. So if you're exposing yourself to it, you are destroying the defense mechanism. So if you destroy the defense mechanism, it means that now the cells can do whatever they like. I mean, your chances of the cells doing whatever they like is very high. Smoking affects almost all kinds of cancers, not just breast, all kinds of cancers because of this. And then alcohol consumption too. It's not like smoking, but if you drink excessively, when I say excessively, I mean for women, say more than 1 unit of alcohol a day, or binge drinking, frequent binge drinking. These are bad, and you are increasing your chances of getting breast cancer. Another one is obesity, especially after menopause. So obesity and lack of physical activity, I'll say that it's basically the same point. And this happens because the body tends to kind of transform fats into estrogen. So if after menopause you have a lot of fat and it's being transferred into estrogen, the more your body is being exposed to estrogen, the higher chances of getting this horrible disease. So as you can see, hormonal factors, long-term use of hormone replacement therapy. So what is that? Usually when women get menopause, sometimes the symptoms such as hot flashes, vaginal dryness and stuff, it becomes a headache for some women. It depends, everybody and their body. So sometimes for some women it's too severe. So we kind of like put them on estrogen to help combat these symptoms. So if you use it for too long, you are increasing your chances of getting breast cancer. The same logic, early menstruation. So I'm sure we all know that menstruation, the whole menstrual cycle and everything is hormonal. So if you're a woman and let's say you start menstruating at 11 and then you stop at, that's what you get menopause at, say 55, compared to someone who started menstruating at 14 and stopped at 48. The first woman's chances are increased because she has been exposed to estrogen more and more. So her chances are increased. Let me add this. So last time somebody asked me a question that does pregnancy kind of like protect against this particular factor? Yeah, per the literature, yes, it does. Per the literature, because if a woman is pregnant, let's say if you have 5 children in your lifetime, that is about roughly 5 years of no, in quotes, no menstruation. So in a way, it's kind of protective. I'm not saying you should go and get pregnant. This is just a bit of theory, but it's true. Pregnancy is protective. Okay, so my brothers, we are not left out. Even though breast cancer, we are always saying women, we can also develop it. So about close to 1% of all breast cancer cases occur in men. And mostly it's in older men, 60 years and older. And then the same thing, the genes that I spoke about also increases the risk in men. But most of the time, most men who tend to get, we shouldn't be too afraid, because most of the men who tend to get breast cancer are, we call something syndromic. So this Klinefelter syndrome is a disease in which ideally, before we say you are male, biologically male, these days, this is a very controversial topic, but before you say you are biologically male, it means that your sex chromosome is XY. And then with the females, it is XX. But this Klinefelter syndrome is a condition where people are born with XXY. So they have 2 X chromosomes. So that's how come their chances of getting breast cancer is quite increased. And then if you have chronic liver disease, so in chronic liver disease, there's high levels of estrogen. So the same thing, if you are being exposed to estrogen, you increase your chances of getting breast cancer. But generally, men are not part of this conversation, generally speaking. I mean, this is quite rare. And then exposure to radiation. So sometimes, let's say you've had a certain cancer, say the childhood cancers, and we use radiation therapy to treat it. So if it's around the chest area, your chances of developing breast cancer goes up. This is not just for men, I mean women too. And then obesity, so just like in the women. Okay, so here are some pictures showing some women with breast cancer and how the breast may look like. So we have different types of breast cancer. In the first image, you can see that there's a lump, and then there's some, we call it dimpling. So when somebody smiles and we say the person has a dimple, see that it means that there's a small kind of like hole over there. So if your breast, you see something like that in your breast, you should be a bit worried and you should seek medical attention immediately, because it's a red flag when it comes to breast cancer. And then this image, you can see that the nipple, I don't know whether I can see it well, but the nipple is a bit inverted. So usually the nipple is pointing outwards. But if your nipple is originally pointing outwards and you notice that it's kind of like becoming inverted, you should also draw your doctor's attention. But if naturally your nipple is inverted, that's what I want. It can be a normal variant. And then if you can see this same breast again, we call it podorange. So kind of like orange peel. it looks like the breast doesn't look like a normal breast. You can see a lot of hair around it, making it look like an orange peel. So this is also a very huge red flag in certain types of breast cancers, not all types. So if you see that your breast, in fact, basically, if you see any changes in your breast, especially if you're more than 50, any changes at all, because we know our breasts, we know how our breasts look like. And this goes to the men too. You know your wives, you know your girlfriends, you know how their breasts look like. So if you see any changes, you should also alert them and say, oh, maybe I think there's been a change in how your breast feels like or looks like, so that the person can quickly seek medical attention. This is a very sad one. It's quite rare, but it can happen. So it's very, very, very late. I'm sure this woman is from a very deprived place, like a village or some place like that. Yeah, so we've basically spoken about these things already in the pictures. The most common reason why women come when it comes to breast is a lump. Yes, but it's not in every single time that you see a lump. You can have breast cancer without a lump, or let me say without a noticeable lump. That's a better way to put it. And usually the lumps tend to be painless most of the time. It can be painful, but most of the time it tends to be painless. And like I was saying, just any changes in the breast, that's the best way to kind of like summarize the whole thing. Any change that you see in your breast, especially when you're above 50, you should draw your doctor's attention. It's not just lump. So the dimpling I was talking about, if you see even the shape or size, sometimes even a rash, if not any rash, then you come to the hospital. No, if you know that maybe you applied something and you are reacting, that's different. But unexplained rash, which has been there for long, it could be your body is telling you something. So if you see anything that you cannot put a finger on, kindly come to the hospital so that it can be checked for you. So this is the nipple inversion I was speaking about. And then discharge. So there are a lot of nipple discharges. Number one being the main purpose for the nipple, which is milk. But if you see any unusual discharge, especially if it's bloody and it comes spontaneously, that's a huge red flag and you should draw your doctor's attention. And then even though, when I mentioned lump, I said usually it's not painful. So even though pain is not a very common symptom, it may be the first sign of breast cancer in some women. So if there's unexplained pain, which is especially long-standing, please seek medical attention. So what are some of the things that we can do as men and women to at least prevent or attempt to prevent breast cancer? Healthy diet. As for healthy diet, I cannot stress on it enough. It's very, very, very important. These days, I'm happy I'm speaking to HR. So the foods that we eat in our various companies, are we making sure that they are balanced diets? Are we making sure it's not too oily? Are we making sure we are getting our fruits, our vegetables? Are we involving even dietitians in how to, because there are some people in the companies who have certain conditions where they are not supposed to be eating certain foods. This is not limited to breast cancer alone. But are we doing that for those people? Getting dietitians to make special diets for them and stuff. And so all go a long way to help. And then regular exercise. Again, I'm happy I'm speaking to HR. So these days, our lifestyle, basically our work, has made it very difficult for us to move. I won't even say exercise, I'll say move. Most people sit all day. They wake up, in the morning, take their bath, sit in a car, drive to the office, take the elevator, go to their office and sit on a chair, sit down for about 8 to 12 hours, do the same thing back home, eat, and then sleep, wake up, do the same thing. You may not realize it, but you are living a very, very, very dangerous lifestyle. In fact, if you are living this kind of lifestyle, your risk of developing not just cancer, but even cardiovascular disease and stuff is almost like somebody who smokes cigarettes. It's very, very dangerous. Human beings are not made to live a sedentary lifestyle. You are supposed to be moving, exercising a lot. At least if you can do 30 minutes a day of just walking, it doesn't even have to be brisk walking, just regular walking, 30 minutes a day. Maybe you can't do it every day, but at least try and do it at least 4 out of the 7 days of the week. Make it your goal every week. It will go. This is cheap. It doesn't cost any money. The best you can do for yourself. It will go a long way to help you prevent a lot of diseases, not just breast cancer, but then again, also the cardiovascular diseases, things like even diabetes and all those things. So exercise, I cannot overstress it. Please, I beg, let's try our best. And HR, we can also do a campaign, and maybe you can put some posters in your companies to stress on it. The more people see these things, the more they are aware of it, and then the more they are likely to stick to it. And then, as we mentioned, we should try our best to avoid, if possible, if not possible, limit our intake of alcohol. As for tobacco, I'll say avoid completely. Avoid completely. Alcohol, limit. Tobacco, avoid completely. And then, of course, maintain a healthy weight, especially after menopause, because that is when the risk is very, very increased. So these are stages of breast cancer. I'm not going to bore you with this information. This is mainly for the clinicians. So stage 0 to stage 4, to help us, it gives us an idea of like the prognosis. When I say prognosis, your chances of survival. So stage 0 to stage 4. Stage 4 is when it has spread to other organs. And at this stage, it's very, very difficult. It's more likely that it will end up in fatality. And unfortunately, in Ghana, this is the problem. This is where most people come to the hospital, either stage 3 or stage 4, because they will sit there, either due to lack of knowledge or some other reason. Maybe they don't have money or something. They'll sit there and sit there, and by the time they come to the hospital, it's a bit too late. These are very, very, very unfortunate issues. A nice segue into the next topic, which is importance of early detection. So if you've been following what I'm talking about so far, the earlier we detect it, the better. The earlier we detect it, the better. Because if we detect it early enough, it may be in the beginning stages where sometimes even something as simple as a surgery can clear you. That's why we are this breast cancer awareness month. We are telling people, when we are even doing free screening for people, because something as simple as a clinical exam, sometimes by yourself, self-examination, or by medical personnel, can pick up something, and then we'll follow up, and then we'll catch it. And when we catch it like that, it's good. It's better than not knowing, because if you don't know, you'll be there, and then by the time it knocks you down, you are going to, unfortunately, die. So the earlier, the better. We shouldn't be scared. I know some people are a bit anxious when it comes to these things, especially when you have a relative or somebody who maybe died of breast cancer or something. Then they become anxious when they are going for checks. So they don't want to. What is the ostrich effect? It's like they want to act as if it doesn't exist, so they don't go and check. Please, early detection is always better, because if you don't go and check and it's there, it won't go anywhere. Prayers help. It helps a lot, but even prayers will not let it go anywhere. The good thing which is expected of all of us is to be responsible for our health and then take active measures. Join these things. Come to the hospital. The same way when your child is sick, you take your child to the hospital to avoid any complications. Please, you too, do the same for yourself, and your child will thank you. All right. So this is just some of the screening methods that we use. So mammography, which is kind of like the gold standard. I know a lot of you know about it. Women here, I'm sure most of you have probably done some before. And then we also use ultrasound. Ultrasound is usually used in younger women who are less than 40 years, because for them, the breast is dense. It's very dense. And when it's dense like that, usually the mammography is not able to do the job very well. So we start with ultrasound. And if the ultrasound detects something which is likely to be cancerous, then we move on to the mammogram, just to avoid exposing people to radiation and stuff like that. We do MRI too, but usually MRI is for when the results are inconclusive. MRI is also very good at detecting breast cancer. And then what you've spoken about already, the clinical breast exam, and then the last one on the list will be self-examination. So even if you've been doing self-examination, please, when you hear that they are doing free examinations in some hospital, go and let a clinician do it for you. As they have been trained to do it, it's more likely that the clinician will catch something that you may not be able to catch. Okay, so this is a picture of a young lady trying to do a self-exam. And these are the steps to perform breast self-exam. I'm sure we know how to do it. But in case you don't know, stand in front of a mirror. Get a big mirror, like the ones you use for your makeup, or even a bigger one. And then you sit in front of it, and then you look at, first of all, you inspect. So you look at your breasts and see whether there's been any changes. Maybe the left one is looking bigger than the right one. I mean, it's not always the same. There's always some small asymmetry, but if you've seen changes, then you have to draw attention. So from there, you raise your arm, and then you gently examine with the opposite hand, because you obviously cannot use the same hand on the same side. So different quadrants. You divide your breast into 4 parts, and then you check your nipple areola side in a circular motion. You take your time and then you do it, and then you do the other 4 parts. And you can also do close to the armpits, because when it's spread, usually it goes there to the lymph nodes. So that's the breast examination. And you can even let somebody you trust also do, maybe your husband or something, also do it for you, just to confirm. And so this is another so you do it while you are sitting, and you also do it while you are lying down, because both of them may give you different clues. So I believe we've already spoken about these things. And then once you have breast cancer, these are some of our treatment options. So surgery, and then our radiation, chemo. I won't bore you with the rest. Hormone therapy, targeted therapy is not important. But surgery. So lumpectomy, that's where, if it's very, very localized, that's why early detection is important. Then we can just go and take out the lump, see where the trouble is. And it hasn't even spread to the rest of the breast. So you can still keep your beautiful breast and then go and take out just the lump. But sometimes if it unfortunately it has spread throughout the breast, we have to cut the whole breast. That's what we call mastectomy. Cut the whole breast, then you won't have a breast. But even that one, there's reconstructive surgery. I mean, it's better to be alive without breast than to pass on with breast, I guess. Okay. So in all positivity, let's hope that those who have breast cancer have survived and are recovering. What can we do to help? So usually with the physical recovery, of course, as for that one, there's not much you can do to help the person, but the person has to do it themselves, going for follow-ups in the hospital and small physical therapy. But those of us around people we know who have breast cancer, we should know that it's a very, very, very serious thing. Anybody who has any kind of cancer is going through a lot mentally, in fact, a lot financially, every kind of thing you can think about. So please, the little that we can do to help them, even if it's just a chat, a small chat that you can have to uplift their spirits or something like that, then you just do it. You're also contributing to humanity. It's very, very important. Emotional support, very, 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 very important. So regular monitoring, that's for the clinicians. So I'm happy that, once again, I'm talking to HR. So in the workplace, what are some of the things that we can do to support breast cancer patients? So HR, we can put in place, I'm sure you have more ideas than myself, but at least maybe from this you can expatiate on it. So you make work arrangements a bit flexible for once you know that somebody has breast cancer. If the person wants to keep it private, too, please, as much as possible, we keep it private and don't let it spread to the whole company that so and so has breast cancer, so and so has breast cancer. It's not right. And our health insurance and stuff, we should be proactive and make sure that once somebody gets it, it's covering, because everybody is at risk. Once you're a woman, you are at risk. Even a man can get it. We are all at risk. So we should be proactive in these things. I know that teachers have some kind of cushion, which when they have cancer, they get treatments for free at certain places. When I learned about it, I was very happy. So whatever company that you work with, please try as much as possible to do some of these things, because it can go a long way to help someone. And then mental health supports. So like I said, if somebody has breast cancer, they are going through a lot. In fact, sometimes the mental agony is even much more than the physical pain or the physical, what the breast cancer does to the body. The mental agony can be very, 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 in fact, unthinkable. So the little that we can do to help financially, anyhow, you feel like you can do to help. Maybe as a company, you can form a group, go and visit the person, do ABC, and make the person feel like a human being, because sometimes when these things happen, people become very depressed, and they want to take their lives and stuff like that. So let's make it a point to take note of these things. Yeah, so basically the same point that I'm hammering on, very, very important. Our role as HR in raising awareness, where HR is kind of like the backbone of every company, because the human resource is very, 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 very important, and you are in charge of their welfare and stuff. So all these things fall straight into your lap. education campaigns like what we are doing now. I'm very, very happy. Breast Cancer Awareness Month. You're organizing talks and stuff for your members. Very, very good. Workplace screenings. Amazing. If we can be doing these things all the time, we realize that the number that we saw in the beginning of the presentation, where Ghana mortality rate was 50% compared to worldwide, which was 30%. These are some of the things that we can do to match the world, or at least even come lower than that, because that is the goal at the end of the day. Yes, so we can, this is very important, we can train certain people in the workplace to know how to talk to people who have been diagnosed with cancer, because it's very important. It's very, very, very important. Even as clinicians, we go through training on when you know that someone has cancer, how you're supposed to talk to the person. Because we are all human beings. It's not easy. Even the way that you may bring the news to the person can affect how the person takes it and how the person sees it. Whether the person is going to see it as a positive thing, of course it's negative, but as a positive thing or as something that is totally negative. You understand? So if we are able to train some of our managers so that in case your employee tells you that this is an unfortunate incident, you'll be able to handle it nicely and not maybe break down and make it look like that's the end of life for the person. And like I was saying, workplace support groups, that is if the person is comfortable with it. We're all different. Some people don't like these things, which is also fine. You should respect the person's wants and needs. And then access to resources, like I was saying, health services, counseling, and then flexible leave policies. As for this one, I'm sure we are not wicked, so I shouldn't even have mentioned it. Okay, so we are getting to the end of the presentation. We'll end soon. There are some myths that people have been throwing around. Things like only women with family history can get breast cancer. Please, it's a huge lie. I'm sure after this presentation, we are all aware that it's not only women with a family history who can get breast cancer. In fact, most people who get breast cancer don't have any family history. Most people who get it do not have any family history. And then another myth, breast cancer always presents with a lump. It's not true. If we're following, sometimes it can present, even though it's rare, sometimes the first presentation can be maybe a discharge. It can be even pain. So many things, not just a lump. So that's why it's important that you come to the hospital for us to do our checks. It's not, because sometimes it's not just a lump, and even with a lump, there may be a lump that the untrained hands may not be able to catch, but the clinicians will be able to get it. And then I think before the presentation began, the host was asking me about this one, that women with large breasts are at increased risk for developing breast cancer. Please, this is also a big myth. It is not true. Women with, whether your breast is small, medium, or large, you can get breast cancer. The size does not influence your chances of getting a breast cancer. And some people also say wearing a bra, which especially the tight ones, will increase your risk of getting breast cancer. Please, so far there's no scientific evidence to back it. I actually searched for evidence to at least something to support it, but I didn't find anything like that. So far, there's no evidence. So please, we can go ahead and wear our bra, all sorts of bra that we want to wear. We can wear it. And then there's also this myth that women who have had implants are at risk of getting breast cancer. Please, and please again, this is also not true. They are not at any increased risk of getting breast cancer. They are at this, their risk is the same as the average population. Just that it can be a bit hard to detect breast cancer if you've had an implant, like on a mammogram, because of course it may block a small cancer or something like that. So that's the bad thing, but it does not increase your chances of getting breast cancer. So please, if you want to go and get a breast implant and your only fear is because you're afraid you get breast cancer, please, you can go ahead and get it, because it's not known to be true. And this one, I've heard it a couple of times and I can't seem to wrap my head around it, that deodorants can lead to breast cancer. I don't know where it comes from, honestly. But a few people have asked me in the clinic before. It's not true. So far, there's no scientific evidence to back such a claim. We've spoken about this already, that only older women get breast cancer. No, not only older women. Young women can get it, even though it's rare. Even men can get it. So, I mean, if you're an older woman, your chances are high, but anybody with breasts can get breast cancer. Okay. So I think I'll open the floor for questions at this point.
Right, thank you very much, Doc. And we have a few questions there. Let's quickly take it before we wrap up. Patients would like to know the causes of breast cancer.
Okay. So we've discussed that already, but not a particular cause. Breast cancer, we don't say causes of breast cancer. We say risk factors. When we say that, it means that we know that there are certain things that can increase your chances of getting breast cancer, but it's not like there's a cause, like how malaria, when you get bitten by a mosquito and get Plasmodium falciparum, you're going to get malaria. No, we don't know that. So some of the things that will increase your chances of getting breast cancer is if you are exposed to estrogen for a long time. That is early menstruation and then late menopause. Certain things like smoking. Certain things like, of course, you have to be a woman. If you're a woman, your chances are much more increased than a man. And then increased age. The more you grow, the higher your chances of getting, especially above 50. That's when the above 50, the 50 being around menopause. So that's when the chances actually go very high. And then also, if you use hormone replacement therapy in menopause, that one also increases your chances. I think I've mentioned smoking and alcohol. Those are also part of it.
All right, thank you. Manika would also like to know if there are certain medicines such as cholesterol, BP, and sugar drugs that cause breast cancer.
Okay. So this is a very heavy question. This is a very heavy question. But as far as I know, there is no the popular medication that we prescribe for cholesterol, which is usually the statins. They do not increase your chances of getting breast cancer by any significant amount.
Okay.
The Diabetes medications too don't do that. BP medications too do not do that. There are certain medicines that are known to increase breast cancer, the chance of getting breast cancer, but those ones are usually hormonal. So like I said, the hormone replacement therapy. And sometimes to women who have something called osteoporosis, when their bones have become weak and they easily break their bones, the medications that we give them, sometimes it tends to increase their chances of getting uterine, that is your womb, and then breast cancer. But for the conditions that you've listed here, none of them will cause it. So please, if your doctor has put you on these medications, take it and take it every day. Don't think that, or don't listen to anybody on the radio who doesn't know what they are talking about. So yes, it's going to increase your chances.
Okay. And what about having fibroids? Does it make you prone to breast cancer?
Not at all.
Not at all.
Not at all.
Right. And she's also asking, if you know someone who started menstruation early, what should she start doing to help against the future for such children? I think you mentioned that when the estrogen levels are high, some people would be more prone to the breast cancer. So I guess that is in relation to her.
Yeah, so I think the question that she's asking, basically what you can do to help it is get pregnant.
Oh, wow.
Yeah, no. I mean, it's like a joke, but it's actually true because it's that is protective. Okay. Because usually it's unopposed estrogen, we call it, being exposed to that. And usually when you are pregnant, the major hormone is progesterone, even though estrogen is involved, but the major one is progesterone. So it takes over. So women who have had like a lot of pregnancies, their chances are a bit decreased. It doesn't mean you can't get it, or you can still get it, but your chances are decreased. That's all it means.
So we should keep reproducing, huh?
Yes, I don't see why not.
Okay, but then there's another one. She's asking, you mentioned about tobacco, emphasizing on that. Does it mean that marijuana does not increase your risk?
Okay, so so far, marijuana, so for the longest time, because it was illegal, a lot of research hasn't been done on some of these things. But with tobacco, human beings have been smoking tobacco for centuries. That's why we know these things. But marijuana, it's in certain countries that they just legalize them. And I know Ghana, to a lot of people use it these days. So far, there's no evidence to support marijuana increasing your risk for breast cancer. Mm-hmm. But let me talk about smoking. Smoking in general, kind of like any smoke. It's not even just smoking. Any smoke, even if you are in the kitchen or whatever, and you are exposed to smoke for a very long time, it's kind of like, think of it as dirt in your lungs. So the body has to clear it. So it's like already naturally when we are walking around, dust and stuff going into our body. So our body has a mechanism of clearing it. And then now you are also actively adding more job to, what the body is doing already by smoking. So even though there hasn't been any concrete literature saying that it increases your chances of cancer or not, just by logic, we know that it affects, but this one we know that it affects the lungs negatively. But as for cancer, not yet.
Right. Okay. And is it also true that taking out your uterus or womb can also be a catalyst to breast cancer?
Come again, taking out your uterus or womb?
Yes, or womb.
Can be a catalyst. Mm-hmm. No, it's actually supposed to be protective, because most of the time when the people with the BRCA genes mutation. Let's say if you test and maybe you're at high risk of getting it. Sometimes people do what we call prophylactic mastectomy. They go and take out, it's breast cancer, so it can only happen in the breast. So they go and take out the breast tissue. I think this famous actress, Angelina Jolie, did something like that a few years or some years ago, because she's at a very high risk of getting some of the gynecological cancer. So she took out almost everything, her ovaries and everything. Yeah, so it's actually protective. It's not a catalyst.
Okay. We'll take the last two and then we wrap it up. Rose, I think you missed his comment on that, but she wants to know, are men also at risk of getting breast cancer? I think he touched on that earlier. Maybe she missed it. Should they also be checking for lumps regularly?
Okay, so in medicine, we always say risk and benefits, and we compare these things before we put out certain policies. So men, of course, can get breast cancer, and it's unfortunate she wasn't around when I was talking about it, but it's less than 1%, and most of the people who get it, even the less than 1%, more than half have like what I said, the 𝗕𝗿𝗄𝗏 syndrome, which is they have 2 X chromosomes instead of 1 XY like a normal man. And then some the others too, they have liver conditions which have exposed them to a lot of estrogen and stuff. So usually the men who tend to get it are even sick men. You get it, but if you are like, let's say, a healthy man, you can still get it. Anything is possible, but chances are very, very low. But it won't hurt to examine your breast every once in a while, or if you notice any change in your breast, it won't hurt to pay the doctor a visit.
Okay. And then finally, does radiation put one at risk?
Oh yes, it does. I think I mentioned it in the presentation. So mostly, okay, but when you say radiation, we should be very careful, because I know a lot of people think of radiation. There's radiation almost like everywhere. We are always radiating. Even the human body radiates something, right? If you talk to the physicists, they'll tell you. But what kind of radiation are we talking about? Usually, for it to be clinically significant, we are talking about sometimes, let's say, a child will get lymphoma, the childhood cancers, and then we have to treat it. We treat it with radiation therapy. After it has been treated, now they are at risk of all sorts of cancers, especially if it was around the chest area. Then breast cancer becomes a huge risk. But usually clinically significant, that's the kind of radiation that we are talking about. Not maybe going to do an X-ray or no, not things like
that. Okay. All right. Thank you very much, Doc, for taking us through this and responding to these questions. I'm sure if they have further questions, they can still visit the Ghana-Canada Medical Center to be assisted. We would also be having, okay, all right. We'd also be having a free health screening on Friday at the HR Certification Center, premise, just around the GT Bank on the Lagos Avenue stretch from 10 a.m. to 2 p.m. So you can just schedule yourself, find your way, pass through, and you would have your breast screened for free. The Ghana-Canada medical team would be here to assist with that. I'm sure after Friday, if you need to get that done, you could also still pass by their center to be checked. Thank you all so much for making time for this session. And as HR professionals, we would encourage you to continue the education in your smaller units. And let's reduce the stigmatization that comes up with breast cancer, so that those who are affected would not find themselves hiding or reluctant to come out to get the help that is needed. In our policies too that we put up, let's try to factor that in, the support system that would be provided. Let's factor our team members in, so that if there's anyone affected, He mentioned something about the insurance, flexible work arrangements that we could have available in our various organizations. I'm sure the talk would continue. We would still be available. I mentioned again that Friday, we are here 10 a.m. to 2 p.m. You could pass by at East Legon at the HR Certification Center premise, and you would have your breast screened for free. Both women and men are welcome. All right. Thank you once again, Doc. He's the resident doctor at the Ghana Medical Center. Thank you and your team.
Ghana, Canada.
Sorry, Ghana, Canada Medical Center. Thank you and your team for helping us in putting this together and continuing the awareness on Breast Cancer Month. All right.
It's an honor.
Okay, it's 6:06, and we would like to end it here. This was proudly brought to you by the HR Certification Center. If you want to upskill yourself in HR, please feel free to call us on 0244-122-855, and we would let you know all the other courses we run aside this education that we are having as giving back to the community. We wish you a very good evening and stay in touch on our platforms. Have a good evening and bye for now. Thank you, Dr. Oduro. And thank you all too for joining.
My pleasure.
All right. Bye.
Why do 93% of the world's leading multinational companies prefer certified professionals? Because they tend to be committed to higher standards and ethics and maintain an informed intercultural competency. Whether you're seeking to build a career or to upgrade your HR professional career, you need to get trained and certified at the HR Certification Center today. Our experience in training and certifying HR professionals is unparalleled. We're trusted to offer a comprehensive portfolio of advanced professional credentials for the HR professionals worldwide, and today, more than 500,000 HR professionals worldwide in 125 plus countries proudly maintain our credentials as a mark of higher professional distinction. HR Certification Center. Call or WhatsApp today on 0244-122-855.